Welcome everybody to the Couple Nurses podcast. This is a Cup of News edition. Just want to thank everybody for your time. If you guys follow us, make sure to give us the likes on YouTube, Spotify. If you guys don't know that this has a video format as well, we do have some on YouTube. We also release some vlogs on YouTube. We're on all platforms, Instagram, Facebook, YouTube, and literally all listening platforms. Stitcher. Are we still on Stitcher?
We are.
We are still on Stitcher.
And Google Play.
Yeah, Stitcher's not very big. Google Play isn't very big either. But,
Nope.
But we like to dip our toes everywhere, so we're on those platforms as well. And today, another good episode. What's going on, Matt?
Thank you for that introduction. And we are frontlinewarriors.com, couplenurses.com for any announcements and up-to-date news. So today we're going to talk about colorectal screenings, how the prevalence of colon cancer has increased. So screenings have went from age 50 to 45 recommendations now. And sleep aid, there are studies that are linking it to increased chances of early onset dementia and Alzheimer's.
When we looked into this, some of the numbers that we came up with are pretty mind-blowing. I think the main reason that there has been an increase in colorectal cancer is because I feel like when people hear that the recommended screening is at age 50, they put it off for a few years.
They do.
So
50 plus 10.
Right. So some people get their first screening done at 55, at 60. So I think it's a good idea to push these guidelines back 5 years. So now maybe actually people are going to be at the age of 45 and actually thinking about getting a screening like this.
Right.
Instead of going in at age 50, they're going to be going in age like 48 or 49 compared to before. Sorry, I just burped a little bit. Sorry, compared to before where people were coming at 55, 60, but the recommendation actually was to be there at the age of 50.
Right, especially if you look at like the Duke staging. So like if you catch colon cancer early, the chances of actually surviving are very high. Like for example, stage 1 is a 90% survival rate for a 5-year chance. But if you go to stage 3, you already have a 30% survival rate like in 5 years. So you really, it's the whole point of all this is just catching it early. And there's two types of doing it. You could either get like a FIT test, which is an occult blood sampling usually. They check the sample fecally. Or you could get an examination, which is the colonoscopy. So there's two ways of doing it. I took my family members once. It was interesting. Same day surgery, basically. They give you a little bit of like fentanyl or Versed to kind of make you feel funny, and they just stick a tube and do the thing.
Yeah, it doesn't seem like it's going to be the most comfortable thing in the world. Sometimes when we give our patients enemas, I'm just like, imagine if you had to get a screening like that, where it's going all the way through your colon, not just like an enema where it's X amount of inches. And it's never comfortable, man. It's never comfortable. And, the patient uncomfortable. You just have to do it, get over with, and hopefully it works the first time.
Right.
Yeah, but why we initially did this episode about colorectal cancer is because we've seen, the studies are showing that there has been an increase in about 51% of cases of colorectal cancer. And they're estimating that by 2030, there's going to be another 10% increase of colorectal cancer. That's how we decided to get this topic some word, just so people are aware that, hey, this is an ongoing issue. And what we even saw that was even more interesting is that there really isn't one specific link to colorectal cancer.
No.
It's not genetic. Actually, minority of it's genetic. I think only like 8 to 12% of cases are due to genetics.
Yeah, so a small portion of colon cancer, only like 5% are actually like hereditary. Jeez, I'm blanking on the word here. Like, which is like Lynch syndrome, which is linked to mutations and like DNA replications. And another 20% is linked to family history.
Yeah, but I read into the family history part, but what the family history part is, they're not sure if the family history has anything to do with the way their diet is, or is it hereditary?
Yeah, is it genetic or is it environmental lifestyle that's causing the culprit? We don't know.
Right, when taking the family into consideration.
Yeah. And some people like that are at risk for it is usually personal history of colon cancer, such as polyps, if your family had polyps, such as like ulcerative colitis, Crohn's disease, or suspected like colon cancers such as polyps. There's the Lynch, there's the non-polyps colon cancers, the different kinds. And even if you had an x-ray before and had some radiation, you had a KUB like abdominal ones, any radiation x-ray has an increased chance of getting colon cancer.
Yeah, and then another crazy stat that we looked into is that I believe it was Hispanics and African Americans were at a higher rate of developing colon cancer.
Yeah.
So the thing with these stats and with these research is showing that there's an increase in prevalence of colon cancer, right? This is what his evidence is pointing to, is that there is an increase. For sure, 100% there's an increase. But we still have no clue where it's coming from. Numbers are showing that there's an increase, but we don't know why and from where and who's causing it and why it's happening.
Yeah.
So we're still at that phase where is it genetic? Is it hereditary? Is it due to diet? Is it due to exercise, poor lifestyle? What is the main cause? And some of the points that they addressed in these studies is, like Matt said before, well, 5% was due to genetics, 20% was due to a family history that was either linked to genetics or lifestyle, and then the other 75% is unknown. Right? So something we're doing something that's giving us this cancer. It has to be. It might be the food that we eat that we're not sure and nobody wants to admit. Is it lack of exercise? Is obesity causing all these issues? Because it seems like the two main things that are still on the rise are obesity and diabetes, and hypertension is the third one.
Which is a inflammatory state, right?
All of them.
Everything is inflammation. That's what it's linking to, I'm thinking. And there's also, like, we do topics about BPA and how that's affecting, estrogen and hormones. There's just so much environmental things that we're consuming that we're barely aware of that's causing issues. We have to take a step back and figure it out. It's almost like when you have a bad diet, you have to completely reset your diet and introduce foods one by one to see which food is causing that upset stomach. Geez, I wish we had a mass reset to see what's causing issues, but we can't.
Yeah, and they always have that section in Medline or Medscape, the section that's always states lifestyle choices to decrease your risks. But that's always somewhere small and on the bottom or lower portion. So to decrease your risk of colorectal cancer, you should stop smoking, limit alcohol, eat healthy, regular exercise, and maintain a healthy weight. So basically, what it seems like is if you live a healthy lifestyle, your chances of getting colorectal cancer are decreased.
Which is usually what we always point. The evidence is always exercise, lifestyle.
Right.
It's like a dead horse, but we like to always emphasize it.
And because that's you should control as much aspects of your life that you can. You should control all variables. If all variables are able to be controlled, why not optimize each variable? And that way your risk of getting these diseases, getting cancers, getting illnesses, getting diabetes, hypertension, obesity are minimized drastically because you're maintaining an optimal balance of all these variables because they each have their own effect on it.
Yeah.
Because then, yes, of course, there's times where you're genetically predisposed to these things, and you can't do anything about that, right? So why focus on that? Just try to minimize the chance of that being activated, of that cancer being genetically activated in your system.
I agree with you, and I always look at epigenetics to be a giant culprit of things. So I feel yes, you're right. If we don't take that time to take care of our bodies and tell our DNA the correct building blocks for the protein to create the messages to replicate properly to not cause mutations in these cancers, that is the golden ticket. Mm-hmm. Yeah,
100%. I couldn't agree more.
And when it comes to testing, so a little bit of medical background, when they do stool tests, you either get a fit test every single year moving forward if you're have a high chance. You could also get a high sensitivity fecal blood occult test. We usually do that when it comes to our GI bleeding patients. So when it comes to colon cancer, especially on the right side, it takes longer for it to be diagnosed, right? So usually these patients, this tumor is it angiogenesis, where there's so much vasculature to that tumor, so much blood supply that you start leaking blood into the gut because the mesenteries are so damn vascular. And those cancers are always caught so late because that tumor has so much ability to grow before we catch it. Usually you're asymptomatic. You just get anemia because you keep feeding that tumor compared to that left side.
Yeah, and speaking of gut health, Matt and I have purchased Viome. If you're not sure what Viome is, we should probably do an episode on the Viome explaining why we did it, what the plan is to show, and how it works. So what Viome does is basically there's two tiers. There's one that's just a stool sample and one that's stool and blood. So we did the higher tier where they get our stool sample and they get some of our blood and they check certain genetic markers. They check our poop to see if the food that we're eating is leading us to have an inflamed gut and how our stool is shaped and whatever's in it, whatever they examine, supposed to tell us on what foods to eat, what foods to avoid, and how to basically optimize our diet.
Yeah.
And then the blood sample tells us other genetic markers about how foods affect our blood, and it's supposed to be a little bit more in depth.
Yeah, it's fascinating how you could definitely study your metabolites from bacteria and then figure out what's going on. Hey, stop eating apples and tomatoes because tomatoes and apples contain this virus that are causing this microbial warfare in your gut that's causing inflammation. It's wild how deep that analysis goes, because I did this last year, but I never did the finger stick. So it's going to be cool because we get to find out like our biological age. We get to find out like our mitochondrial health and all that. So yeah.
But that's kind of spooky because now they have our stool samples and our blood sample in their labs. So they know which blood Piotr Findora has and which blood Mateusz Slatrick has.
Is that, yeah.
Like, this is their poop, this is their blood.
They might have that data now, and who knows what kind of value it's going to have in the future.
Mm-hmm. They might have you marked. What if you decide to sell this to insurance? What if your insurance is going to be... What if we become such a health and data-driven society that our health is going to be mapped on a computer and insurance is going to look at that health mapping and give us the cost for our health insurance?
Yeah.
Imagine that's how it was.
That's going to happen.
It's totally possible.
It's already going to happen because...
Like they do the swap for smoking, don't they?
Yeah, they do. And yeah, if you smoke, your insurance goes up in premiums already. So imagine how more... in depth it's going to go. And a little sneak peek, right? We talked about the World Economic Reform that we're like creating an episode for. They want to focus more on home health, right? So imagine having these like toilets and everything armed where everything is going to be AI analyzing your urine, or hey, you're missing this. Hey, Piotr, drink some potassium today. Or make sure you have a banana today. Your potassium is low in your urine.
That's preventative. That could be a really good thing.
Exactly.
It just depends on who uses it and how to use it. Just like really anything else.
Yeah, it's a very scary slope because hopefully like ethics catches up to things like always when it comes to AI and everything, and that we have a kill switch on artificial intelligence, because like it gets scary where yes, it's for health, but also it could like go a scary way.
Yeah.
When it comes to management of colon cancer, so depending on where the cancer is, you might have a surgical resection. So usually they do colectomies. If your cancer is like in the rectum area, you wanna heal that part after you cut it out. So they do a colostomy. For those that don't know, that's basically your bowels coming out of your abdomen, right, to an ostomy, which is an opening, and that's where poop goes. It's so crazy. I had a patient that had it ever since the age of 16.
That's crazy.
And he missed prom and everything from having ulcerative colitis.
Yeah.
Early on.
That's such a drastic life change.
And he was never married.
Yeah.
It could be just a whole self-esteem thing,
Yeah.
like for ages. It's so sad.
It's very sad. It's a big thing to like accept. Imagine how that affects your love life, your sex life, like your friendships, your family. You're pooping in a bag continuously. It's nonstop. You can't hold it in. You can't wait to go to the bathroom. It's just there. Every time you eat, you expect it to get full.
Yeah, imagine going to the beach and you're just like throwing a football around and
Yeah.
there's just poop coming out of the side of your abdomen.
Yeah.
That's just things that you have to accept having one of those.
Yeah. That's wow. It's very drastic.
And then also with the surgical management, they're also going to resect some from the lymph nodes. Depends on what happens with the cancer. So you guys know that cancer metastasizes, it sprouts, it hops on the lymphatic superhighway, and then it could spread to other organs. So if you reach that stage, metastasis, based on a Duke staging, your 5-year survival is less than 10%. And that's why these screenings are so important, because we want to prevent that late stage, especially cancer developing on the right side of the abdomen.
Yeah. Another important topic we wanted to address in this episode is the links with anticholinergics and Alzheimer's disease and dementia. The most common anticholinergic medication that you're probably going to hear is basically Benadryl, right? It's anticholinergic.
Yep.
Helps you. You could say it makes you drowsy. A lot of people use it for allergies, for seasonal issues, and some people actually use it to help them sleep. And the research is showing that if you use an anticholinergic consistently for 3 months or greater, that your chances of developing dementia or Alzheimer's are greatly increased. And that's a common over-the-counter medication that the elderly people use. I believe the chances of getting dementia above the age of 60 is like 30% 5 years after that.
Yeah.
So imagine having those risk factors, and then you're doing anticholinergics every day for the last 1 year. Imagine that, because they help you sleep or whatever.
Right. And it's so socially acceptable in like Western society to take anything. Like, oh, I have a headache. I'm not going to drink as much water. I'll just take a pill. Same thing with sleep aids. I think, I don't know what the 1 in 3, 1 in 5, who knows, based on studies, right? That we all have like a sleep disorder. We have like mental problems, financial stresses, relationships, and we can't fall asleep. We have that roommate that keeps on talking. We can't shut him down. So we take melatonin. That doesn't help. We take some NyQuil, some Benadryl. We want to get knocked out, like sedated, and we don't know these long-term consequences. And now we're realizing that, hey, dementia's on the rise. Is it just food? Is it something else that's contributing to this? Because isn't that wild how just in the last like couple decades, all this came to be? And now we're in the forefront where research is coming out and things are constantly changing. That's why I don't understand how people think that science is fixed.
Yeah.
And dementia, like the healthcare cost is $290 billion United States, just in 2019 alone. So, this is a big deal. Just, I don't know if you mentioned that in 2030, it's supposed to double. And 22% of the U.S. population, the age of 70 and above, has some cognitive impairment with dementia.
Yeah. That's crazy, man. A lot of people don't know that these medications, we like to have them target certain things to produce certain effects to better symptoms. But you got to understand that these anticholinergic drugs, they affect acetylcholine. So your acetylcholine is important in memory, in learning, in muscular contractions, as well as its antihistamine effects. But the thing is that we can't pinpoint which acetylcholine is going to produce antihistamine actions, which one's going to produce all the other actions, right? We can't just target that. So this is what happens is that over time, the overuse of these medications, it starts to disrupt all these channels. And the more channels you disrupt, the higher chance of you disrupting more of them, obviously, and then those are going to produce greater effects and other signs and symptoms that you did not initially want just to cover that symptom.
Yeah.
Like you might have gotten rid of those, that sneezing, that stuffy nose, and that fluid coming out of your eyes, but you also increase the chances of you getting Alzheimer's. So which one would you rather pay with? Just a runny nose or Alzheimer's
in the future? And we don't think like that because we trade these things for quick symptom management. And it's wild how like the body works because it's always trying to restore its homeostasis. And we're like taking these pills to do one effect and it's disrupting this. It's like even like caffeine. It's like we're trying to overclock our damn CPU to get that same stimulation.
Yeah.
But maybe you're just tired or there's something else going on, or your energy's too stuck in your damn brain where you're just getting too depleted,
It's that short-term pleasure that we chase. We want symptom relief right now.
Instant gratification.
And the thing is, that goes with disease as well. We rather not treat the disease, rather treat the symptoms of the disease. And if you get rid of the symptoms of the disease, then that's enough for us. We're okay with having the disease. We're not okay with having the symptoms. If we just pile on things that match the symptoms up until it builds up and builds up and builds up and we have like a stroke or a heart attack or something, life-changing and altering, that's when we realize, hey, we messed up. We should have been treating the disease, not just the symptoms.
Yeah, and like polypharmacy is one of those things because I'm just thinking about it right now. I was talking about homeostasis. Like imagine you're just polypharmacy a patient constantly. That body doesn't know how to establish its like equilibrium. Yeah. So back into the study, October 23rd, 2020, they took a bunch of systematic literature reviews, long-term studies of 3 months or greater of anticholinergic uses. Based on this study, they mostly were assessing it because it was a urology study, overactive bladders. So patients that were taking oxybutynin. So they analyzed 21 studies, and their conclusions show that anticholinergics for 3 month or greater use increased your chances of developing dementia for an average of 46% versus non-use of oxybutynin, which is an anticholinergic.
Yeah, the other study that we looked at took over 980,000 participants and found an association between benzodiazepines and development of dementia. So like your Xanaxes, those are your Benzos. So a long time and progressive use of Benzos is also showing ailing to Alzheimer's. A lot of people use Benzos to cure their anxiety or help them with their sleep, or just they just hang out, and some people it's a drug of choice. It's like it's one of the party drugs too. Imagine if you partied hard with Xanax for, let's say, a year of your life. Imagine how mental toll it takes on you, especially if you're still developing. It's a giant hindrance.
Yeah. Because
this drug not only affects older people that messes their brains up and causes them to have Alzheimer's, but it also messes up teenager brains, younger kids' brains, because it's messing with their developmental process, and not developing the proper channels. That's why like drugs and teenage use is so dangerous, because your brain is still developing.
Yeah.
And if it doesn't hit certain things in each process, guess what? You're not going to develop properly as everybody else.
Especially like taking Ritalin for kids. You know, like that's what's one thing that is interesting is we're all put through the same educational system. Like imagine if you're a talented artist that you're going to be in the future. You can't sit through geometry class 5 days a week. It's just driving you crazy, but you have to. And these poor kids, you know, get Ritalin just to stay there and be focused and pay attention. Like it's just, it's so sad. And we don't know the long-term, you know, side effects of depleting, you know, serotonin constantly. Like what if developmental ages show that, hey, if you deplete your serotonin for the first like 10 years of development, it's never going to be the same. Now this patient is always at risk for depression.
Yeah.
We don't know what we're doing yet.
Yeah.
But it's just, hey, it's a quick fix. It's a doctor. We have these standing orders. This is how we treat. And sometimes we never look back and evaluate, especially in Western culture. We're just trucking forward and let's like fix things in a different way. For example, what we just talked about colorectal cancer, right? So the American Cancer Society is recommending to increase screenings from age 50 to now 45. Yes, we could, you know, potentially catch cancer early, colon cancer, but what else can we do, which is the preventative medicine that we're not really focusing on here to get, you know, to reverse those numbers, that to not be part of that statistic.
Right. Damn. Yeah, just imagine having a kid that's developing. Their brain is trying to figure out their hormonal balance, their neurochemical balances, how much norepinephrine they should release, how much dopamine, how much serotonin, how much adrenaline, and you introduce something like Adderall, which is going to increase your dopamine. And your body gets used to getting dopamine from an outside source, or from an outside source causing a production of it, where it doesn't think it has to worry about having dopamine anymore.
Yeah.
And you're gonna be for the rest of your life deficient dopamine. So you're gonna be lifelong dependent on something external to give you enough dopamine in your brain. That's the people that are deficient like testosterone. They require testosterone injections to maintain a normal testosterone level for an average male.
Yeah.
Imagine like somebody really young doing steroids, and somehow the body switches off the production of testosterone, and then they're lifelong dependent on testosterone injections and testosterone supplements because they fucked up their body at a young age because they started to mess with these hormones, and they got huge for a little bit, and then in the long run it screwed them over.
Yeah.
It's those short-term pleasures that we always try to achieve, and we're blind to these long-term effects
Of what else can happen.
of what else can happen. Exactly. And you know, that's how life works.
It's like us being, you know, young. We started drinking early on. We're
I don't want to say like Darwinism,
like
but
50.
that's just how life works sometimes.
It does, man. I mean, it's survival of the fittest. Yes and no. I believe it half. And it's funny because, yeah, like look at us. We were drinking early on a lot. Drink till you black out, till you throw up. It's just, it was stupid at the time. But hey, now drinking can lead to dementia and there's all these risks. But at the time, we weren't just thinking.
Yeah.
But what can we do? We just arm ourselves with the time that we have now and the knowledge. So anybody that's listening, you know so much now about digestive health, like in the past 3 episodes you listened to. What are you going to do with that information? What if you have symptoms of frequent diarrhea or having a lot of bloating or maybe being, you know, lactose intolerant? Are you going to continue doing that? Are you going to change something? Like that's like one of my goals always, like podcasting. I hope someone takes some value out of this and makes some kind of incremental positive change in their life. I'll be satisfied with this episode if that happens.
And the best time to start a change is now. Like, stop thinking it's gonna be a best time to do things. I'm gonna wait till Monday because it's the first day of the week. Just start something small now and just continue with it. And just that one thing, it's really some kind of improvement in your life. And you know, so you're not always complaining about some nonsense, some bullshit. Like, take life by the ball sometimes and do something different, something about it.
Yep.
You know, because no one's gonna do it for you. And you know, ask for help if anything, because a lot of times, you know, people need help and no one knows you need help if you don't bring it up. So it's like, we're not mind readers yet.
Yeah.
But one day maybe.
One day.
Neuralink and stuff.
Neuralink, yep. So just to summarize this, benzo, sleep, and dementia, we don't know the exact link between how this is being affected, the mechanism of action, but we know that there is a positive correlation. So we still need more research to establish these links, just like we talked about the gut sometimes. There's correlation, but we can't pinpoint it. So take everything with a grain of salt, as always. Appreciate you guys listening. Hope you guys enjoyed the episode about colon cancer and early dementia. Have a great day, great week. See you guys next week.
Stay humble.
Stay humble. Peace.